And the goal is, it is the gateway to authentic health information for all. So we make to aim this is a single point of access, or rather the first point of access for authenticated health information for citizens, students, healthcare professionals, researchers, everyone. And it will be doing by collecting, verifying, and disseminating health and healthcare delivery services related information for everyone. This is how it looks, the homepage looks as of now. Ultimately, it will be available in all the 22 scheduled languages in India. Currently, it's available in, other than English, it's available in 4 regional languages. So we have the Hindi version, we have in Gujarati, Bangla, Tamil, and also Punjabi. The National Health Portal is quite interactive. So we have forums for discussion. There's a general forum, there's a professional forum. In fact, we have actually also formed a forum for the implementation of the EHR standards. And there we have some resources, whether workshops are coming on, information on that, and of course the discussion forums. We are also having the feedback section, and we regularly update based on the feedback. We are very much present on the social media, so we have a page in Facebook as well as on Twitter. And this is the EHR standard. We also have microsites developed for different events or particular days, like we had the celebration for the International Day of Yoga, which started this year on June 21st. We recently also launched a mobile app for the directory services. Right now we have the hospital and the NACO-supported blood banks, which are available through this mobile app, the National Portal Mobile App Directory Services. It's available in the Google Play Store, because right now it's only Android version is available. Then we also, the Honorable Minister recently launched the Voice Portal, the National NHP Voice Web. This is a phone-based service, because even though we would like to have internet all over the country, but the penetration as of now is less than 30%. And where there is no internet, we still need to send the information, because information is really what's needed. We don't have an informed healthcare delivery system here. To make that, we need to spread out. This is a toll-free number, 1800-180-1104, and this was launched by the Honorable Minister, Mr. J.P. Nadda, during the Digital India Week. As a part of Digital India, in fact, there are lots of initiatives. If you look at it for e-health, in the e-Kranti, there's a technology for health, online medical consultation, medical records, medical supply, and there should be a pan-India health information exchange. So all these are within the vision document of the Digital India plan. So some of these activities we are already planning to have it through the National Health Portal, or at the center, that's the Center for Health Informatics, which is likely to become an autonomous society registered. And once the National E-Health Authority is set up, it will be acting as the secretariat for the National E-Health Authority as well. Probably the first thing the National E-Health Authority needs to do is to have the National E-Health Strategy. Yes, we are very much ahead in IT. We are doing lots of things. And we have also, the ministry has notified the guidelines for EHR standards. We are a country member of IHT-HDO. So SNOMED City is available for free use in India. We need to leverage on that. We need to have a very systematic, well-organized national e-health strategy in consultation with all the stakeholders, because health is a state subject in India. So the states also need to be very active, and if we formulate a proper policy or strategy for the national e-health initiatives, I think we'll be going the right path right from the beginning, rather than a few years later look back and see, oh, what a mess we are in. So that's all for the presentation part. I'd be happy to respond to any questions if you have. Thank you.
Thank you very much. To be frank, we just have a very limited amount of time left, but I wanted to frame a very brief reaction from the panel in this way. Clearly, we've seen a lot of the depth and breadth of digital health in terms of the issues, the priorities, the experience, the tremendous capacity, the various dimensions that is required to ensure even better and more effective digital health is implemented here in India. I'm going to just maybe ask a set of questions, and I invite the panelists to Please just respond to one or two of them and maybe relay a key message that you have in just 1 or 2 minutes. But some of the things that we might want to hear your various perspectives on are what is still needs to be improved or changed to reach scale and sustainability for digital health in India? How might digital health enable universal health coverage? How can multi-stakeholder engagement such as the India Health Information Network make a difference? What about enforcement and compliance of digital health standards? How can that be implemented? How might we get patient or provider user input more directly into the planning and design of digital health solutions? What about your experience with testing, adapting, innovating as you learn as you go, interacting with the beneficiaries of digital health to make digital health better? And from a partnership standpoint, what are some still available strategic opportunities in the marketplace or with different partnership arrangements to ensure more effective digital health going forward? So I'm just going to pass the mic and ask you to be brief, respond to some of these questions, and make any key points, and then we will close. Thank you so much.
I will pass it.
I'd like to dwell a little bit on the question around how do we get patient and provider participation into design of many of these digital health solutions. We tend to involve a lot of organizational and institutional stakeholders in the design of these solutions, but we tend to neglect to some extent the voice of the common man, of the lowest level of general practitioners, of people out there in rural areas, ASHA workers, Ayush practitioners who contribute a great deal towards the maintenance and support of the healthcare system and actually delivering healthcare effectively to people. I think as it's both a state and a national subject, there has to be a tremendous push towards getting states involved in doing grassroots level analysis of the unique cultural and environmental practices of health in each of these states. India is not a single country; it's a subcontinent. There are 25 different cultural practices across the nation, even in something as simple as health. I think unless there is a significant push by the states to get grassroots level feedback and push that feedback up to the center, up to the National E-Health Authority, and incorporate that feedback into the policies and design of these solutions, and those are then pushed down from NEHA back down. I think this iterative process, this circular process is very, very key. It cannot be a pure top-down approach. To a large extent, all of us live in our ivory towers, every one of us, because we really don't sweat it out in the heat and dust and in the grind of actually delivering health care to many of the deprived populations of this country. That grassroots level feedback incorporation from very, very simple, normal human beings that populate this country, I think is a key element of ensuring these variables are incorporated.
First, I will appreciate the steps taken by the government in the last couple of years in starting many initiatives around health. Each one of these are really transformative, have not been done since past several decades. So hats off to them. At the same time, the pace at which these initiatives are being taken and the pace which is required in Indian society gap is very, very vast. And I think Indian government can do a lot of things very fast in making sure that whatever we are doing with the right intent is acknowledged and rules are there to encourage it. Most of us or our families would have ordered medicines by telephone to your nearest medical store. But how many of us know that almost all such orders are illegal? The acts are 1940 Drug and Cosmetics Act, 1945 Drug and Cosmetics Order, 1950 some Drug and Magic Act, some 1956 amendment to 1940 Drug and Cosmetics Act. All these acts were there when there was no telephone, there was no internet, there were no nearby medical shops also at that time, only hospital pharmacies. And unfortunately, those rules, those acts are not being rewritten as per current status, making certain that if I want to put almost all the Indian citizens under the prison, I can do so, because ordering such medicines or even providing such medicines, both are illegal basically. Everybody knows that no prescription has ever been stamped in India by any pharmacy, be it hospital pharmacy or by a pharmacy outside. Still, every second day we hear in the newspaper that this particular prescription has not been stamped. There is a self-medication, there is abuse of medicines. Question is that, why do not we come out with right kind of methodology? Why do not we come out with right kind of cards where it can be recorded and evidence can be there that how many times medicine is to be taken and how many times it has been dispensed? We talked yesterday about Tripura, telemedicine and all that. How many of us know that providing telemedicine, even if it is a great initiative by Indian government, under certain rules and bylaws it is illegal. It cannot be done because as per the laws which existed on that day, telemedicine could not be thought of, could not be conceptualized. So if a large private organization, government cannot provide health to everybody. Private partnership is required, a must. Collaboration is absolutely necessary. But I think government should act fast, make sure that rules, regulations are contemporary, and vast majority of, I will say, army or others who are not always busy kind of thing can be re-skilled, can be asked government hospitals, primary health centers can be equipped with new knowledge, new methodologies, and we can take the health at least to the block level, if not to the village level. Thank you.
Well, thank you, Chairman, for getting a comment. Now, medical and health is one of the very specific and a little complicated kind of an issue. Everybody probably may not be understanding it. But at the same time, we have to marry this with our modern information and technology. Now, this itself is a big challenge, that how we make all kinds of related groups together on one platform. Number one. Number two, I know in our country, which is also one of the home for ICT, we are making efforts in different platforms, different fora and different things. So first and foremost thing is, first of all, to bring them together so that we can even standardize our own communications, So that is the whole issue. We have tremendous, let me tell you, if we start looking into every nook and corner, we are doing work, like on the panel. So that is the one issue, we have to bring it together. And I'm sure Ministry of Health, why only Ministry of Health? Even Government of India with the knowledge sharing, with the platform. I still remember a couple of years back, we made it. Now the Prime Minister has made the Digital India. And now Ministry of Health has also made an effort that we bring it together as far as health is concerned. So that is a very clear message we have to make it. So right kind of approach, linking together and making it standard, I think this is the issue which is important.
Great, thank you. Anybody want a last word? Okay, I really appreciate our distinguished panel this morning. Fantastic perspectives all around. Let's give them one last round of applause and thank them again.